Hello, this is Natasha Tracy for Breaking Bipolar here at HealthyPlace.com. Today I want to talk about kids and mental health information. So today I was talking to some different people about giving some information about mental illness and bipolar disorder to kids who are only 12 or 13 years old. And at one point, one of the parents had an issue with that. They were concerned that the subject matter, the way that I told it, might be a bit too heavy for people at that age. I understand. She certainly had a point. But I think it's really important that we do talk to 12 and 13-year-olds about mental health. I think that it's important that we talk to people as young as possible about mental health. And that's because we know that in the event that a problem should arise, the sooner a person gets help for an issue with mental illness, the better their outcome. So a 13-year-old, for example, who is starting to experience the symptoms of bipolar disorder, if they are to get help for that disorder, they often will have a better outcome than if they waited until they were 24 years old, for example. They can get treated more effectively, and they can often get treated faster, which of course is what we always want to see. And by the time someone is 12 or 13 years old, I would argue that they have run into mental health issues. Perhaps not their own, of course, but I would think that even someone that young would have a parent or a sibling or an aunt or a friend or someone in their life who has mental illness challenges. Certainly, many kids are used to having friends who have ADD or ADHD. That's pretty common. That's a mental illness. That's certainly something that parents could address at a very young age. And then, of course, there are other mental illnesses that we see in youth. And by dealing with these subjects early, hopefully, we can get kids used to the fact that if you have a problem, you can get help. And if you get help, you can get better. Treatment works, but you need to get the treatment. That's the message that we need to give kids. Because by the time a kid is 13 years old, they're going through puberty, maybe even younger than that, and things can start to happen. For example, eating disorders. We know that eating disorders can happen in children even younger than 10 years old. That's something that we all would like to avoid. So education early can help stem that tide. Self-harm, something that runs rampant in the teenage population. Something that can be addressed through mental health information. And those kids who are exhibiting those self-harm behaviors can get help and they can stop. And of course, there's the problem of teenage suicide, the problem that we want to avoid most of all. We absolutely want to encourage people of that age to get help whenever they feel that they need it. There are teachers and counselors and doctors who are there for them. And all that information needs to start as soon as possible. Because the last thing we want is to have someone who's 18 years old, who's now an adult, who's been suffering from a mental illness for 6 years, let's say, and has no idea what to do. Because by the time they're 18, that's not the time for education. The time was 10 years ago when it really could have helped them. Yes, every 18-year-old can get help, but gosh, wouldn't it have been great if they didn't have to live their whole teenage years in pain? So early mental health education, I believe, is critical. My name is Natasha Tracy, and this is Breaking Bipolar.